While the advent of the 988 line gives people a new number to call when in a mental health crisis, Lincoln Police told me it's still a daily part of all officers' jobs, forcing them to amp up training and resources to meet needs. It starts with dispatchers.
Answering those calls to coordinate responses for suicidal depressions, panic attacks, traumas, missing loved ones.
And ends up in the hands of officers.
And our job is to respond, try to de-escalate, and problem solve with the individual who is out in the community to try to get them in touch with whatever resources may be most appropriate for them in that particular moment.
Members of the Lincoln Police Department we spoke with say getting those resources isn't always easy, largely due to high demand and sometimes limited options.
Obviously, we're limited to the facilities that we have here to work with. So there are occasionally capacity issues.
They've experienced some of the same struggles of bed shortages that result in community-wide impacts.
Greater capacity both in our crisis center and then down the line to the regional center would assist in decreasing officers' sort of standby time with people.
The department has been working over the last few years to increase internal resources, like adding a mental health officer who works with those who are often the subject of calls for police or who call themselves.
We were able to see a tremendous success in several of those individuals who at one point in time, may be calling our dispatch once a day, a couple times a day, but now be connected to a community provider and to be able to flourish and go on and live happy and successful lives.
They've also added Melissa Ripley as an officer who focuses on Lincoln's unhoused populations.
It's important for us to have just a friendly face that can go out, not always on an enforcement side of things, but also on an advocacy side of things as well. We're never going to arrest our way out of homelessness.
The department also recently launched a program where if someone calls 911 out of concern for a person who is unsheltered, they'll send street outreach experts to them instead of a uniformed officer. And on the horizon, there's talk of a CoResponder program where mental health professionals will go along with officers to scenes. Captain Ben Kopsa says this kind of progress will help everyone involved.
Officers will remain available to take criminal calls, and then secondly, it will reduce the amount of contacts that people have with law enforcement and thus reducing criminal justice involvement.
When officers are in contact with someone experiencing a mental health crisis, one of their options is to take that person into emergency protective custody. Concerns about police not doing that enough was brought up by some of our interviews. We'll have that story tomorrow.